Most people think diabetes only shows up when a doctor orders blood work. They imagine the warning comes from a lab report, a phone call from the clinic, or a number printed on a page. And yes, blood tests are important. But after years of sitting with patients, examining them, and listening to what their bodies were trying to say, I can tell you something many people do not realize. High blood sugar often leaves clues long before the official diagnosis. And very often, those clues begin in the feet. I am Dr. James Walker, and I want you to pay attention to this because I have seen too many older adults miss these signs for months, sometimes for years. They were not careless people. They were not ignoring their health on purpose. They simply thought their feet were changing because of age, old shoes, dry skin, arthritis, cold weather, or standing too long. Then one day, a blood test finally showed what had been building quietly inside the body the whole time. Not long ago, I saw a man in his late 60s who came in for what he thought was a normal checkup. He was retired, active, and he told me he felt mostly fine. But when I asked about his feet, he paused. He said, "Doctor, they have felt a little numb for a while, but I thought that was just getting older." Then he mentioned his heels were cracking badly, his ankles had been swelling, and sometimes his feet burned at night. None of these things sounded serious to him. But together, they told a very different story. When his blood sugar results came back, they were far too high. He had likely been living with diabetes for a long time, without knowing it. That is why this matters. Your feet are not just something you walk on. They are one of the farthest points from your heart, and because of that, they often show problems with nerves, blood flow, healing, and circulation before other parts of the body do. When blood sugar stays high, it can slowly damage tiny blood vessels and delicate nerves. The feet often feel that damage first. Today, I want to walk you through 9 warning signs that can appear in your feet when blood sugar has been too high for too long. For each one, I want you to understand what people usually think it is, what may actually be happening inside the body, and what simple daily habit may help protect you. And please hear me clearly. One sign does not automatically mean you have diabetes, but one sign does mean you should pay attention. Several signs together mean you should not wait. Millions of people have high blood sugar and do not know it yet. The danger is not only the sugar number itself. The danger is what that sugar can quietly do to the nerves, kidneys, eyes, heart, circulation, and feet while a person still believes everything is fine. The first sign is tingling, numbness, or a pins and needles feeling in the feet. Almost everyone has had a foot fall asleep at some point. Maybe you sat in one position too long, crossed your legs, or stayed in a chair for hours. That kind of temporary tingling is common. But if the tingling keeps coming back without a clear reason, or if your toes feel numb even when you have not been sitting strangely, that is different. Many patients tell me, "Dr. Walker, it is just a little tingling. It comes and goes." But that is exactly how nerve trouble can begin. High blood sugar can irritate and injure the nerves in your feet. Doctors call this peripheral neuropathy. It often begins slowly, so slowly that people explain it away. At first, it may feel like buzzing, crawling, prickling, or a sock bunched under your toes when nothing is there. Later, it can become numbness, poor balance, or pain. Think of your nerves like electrical wires. A healthy wire carries a clean signal. But when the protective covering around that wire gets damaged, the signal becomes messy. Your brain may receive strange messages from the foot. That is why you may feel tingling when nothing is touching you, or numbness when your foot should feel normal. High blood sugar can act like slow corrosion on those nerve pathways. The daily habit here is simple but powerful. Walk every day if you are able. A steady walk helps move blood down into the legs and feet, feeds the nerves with oxygen, and helps your body use sugar more effectively. This does not have to be a hard workout. A calm, steady walk after meals can be a strong first step. Also, begin cutting back on added sugar in a realistic way. Not next year, not after the holidays. Start with the drink, snack, or dessert you know is doing the most damage. The second sign is burning feet, especially at night. This is one of the symptoms that worries patients the most because it often shows up when the house is quiet, the lights are off, and you are trying to sleep. During the day, you may be distracted, but at night, that burning feeling can become impossible to ignore. Some people blame warm blankets, tight socks, or a long day of walking. Sometimes that may be true, But when the soles of the feet feel hot, burning, raw, or fiery again and again, especially when nothing hot is touching them, it can be a sign that the nerves are misfiring. The foot is not actually burning from the outside. The damaged nerve is sending a false heat message to the brain. I often describe it like a smoke alarm that has a bad sensor. There may be no smoke in the room, but the alarm still screams because the sensor is faulty. In the same way, damaged nerves can send pain, heat, or burning signals even when the skin looks normal. This can happen when blood sugar has been too high for too long and the nerve tissue is under stress. For this sign, hydration matters. Your body needs enough water to help the kidneys clear waste and excess sugar from the bloodstream. Many older adults are mildly dehydrated without realizing it, and dehydration can make symptoms feel worse. Fiber also helps. Foods like vegetables, beans, lentils, oats, and other high-fiber choices slow down how quickly sugar enters the blood. That slower rise can be gentler on your nerves and your blood vessels. The third sign is a cut, blister, or sore on the foot that takes too long to heal. This is where the problem becomes more serious. Tingling and burning are uncomfortable, but slow healing can become dangerous. I have seen patients come in with a small blister that started from a shoe rubbing the wrong way. They thought it would close in a few days, but weeks later it was still open. When blood sugar is high, healing becomes harder. The tiny blood vessels that bring oxygen, nutrients, and immune cells to the skin may not work as well. The body needs good circulation to repair tissue. If the blood cannot reach the wound properly, healing slows down. At the same time, high sugar can weaken the immune response, making infection easier. Imagine trying to repair a road, but the trucks carrying the tools and workers cannot get through. The repair crew exists, but it cannot reach the damaged area. That is what poor circulation can do to a small wound on the foot. The supplies are in the bloodstream, but they do not arrive fast enough. This is why foot checks are so important, especially after 50 or 60. After your bath or shower, look at both feet carefully. Check the bottoms, the heels, the sides, and between the toes. Use a mirror if bending is difficult. If you see a cut, blister, scrape, or cracked area, clean it gently and protect it. If it is not improving after a couple of days, do not keep waiting and hoping. Call your doctor. A small wound in a person with high blood sugar can become a large problem if ignored. The fourth sign is a change in skin color around the feet or ankles. This one hides in plain sight because people see it every day and get used to it. They may notice the feet look darker, reddish, bluish, shiny, or patchy, but they think it is just normal aging, old bruising, sun exposure, or skin tone changes. Sometimes skin color changes are harmless. But when the feet or lower legs begin looking darker, redder, or slightly blue, especially along with coldness, swelling, numbness, or slow healing, circulation must be considered. Blood carries oxygen. When blood flow is poor, the skin may not receive enough oxygen and nourishment. Over time, the skin can change color, become thinner, and look more fragile. Your feet are at the end of a long delivery route. The heart has to push blood all the way down and back up again. If high blood sugar has damaged the vessels along that route, the delivery becomes weaker. The skin may be the first place you can actually see that the delivery system is struggling. A simple morning routine can help. While sitting on the edge of the bed or in a chair, make ankle circles, raise your toes, point your feet, and stretch your calves gently. These small movements wake up the lower legs and help blood move. You do not need fancy equipment. You need consistency. Even a few minutes every morning can remind those vessels and muscles to keep working. The fifth sign is dry, cracked heels that do not seem to improve. Many people say, "My heels always crack in winter." And yes, dry skin is common. But when the cracking is deep, painful, bleeding, or happening even when the weather is warm, it deserves more attention. High blood sugar can damage the nerves that control sweating and moisture in the feet. These are automatic nerves. You do not think about them, but they help your skin stay healthy. When those nerves do not work properly, the feet can become dry from the inside. Lotion may help the surface, but it may not fix the deeper reason the skin keeps cracking. The danger is not just that cracked heels look rough. The danger is that cracks are openings in the skin. Bacteria can enter. If circulation is already poor, the body may have a harder time fighting infection and healing the break. What begins as just dry skin can become a wound. Every night, moisturize the soles and heels of your feet. Use a good foot cream or a simple moisturizer. But do not put lotion between the toes because trapped moisture there can encourage fungus. Keep the spaces between the toes dry and clean. Also, drink enough water during the day. Skin needs moisture from the outside, but it also needs support from inside the body. Before I move on, I want you to pause and think honestly. Have you noticed any of these signs in yourself, your spouse, your parent, or someone you love? Tingling, burning, slow healing, color changes, cracked heels that never seem to go away. If the answer is yes, do not panic, but do not ignore it either. Type the word yes in the comments if one of these sounds familiar. I want this to become a conversation because many people are sitting at home thinking they are the only one dealing with this. They are not. And if this information is helping you, press the like button so this video can reach more older adults who may need to hear it before a small warning becomes a serious problem. The sixth sign is swelling in the feet or ankles. A little swelling after a long day can happen, especially if you stood for hours, traveled, or ate a salty meal. But swelling that keeps coming back, leaves deep sock marks, or makes your shoes feel tight by evening should not be brushed off. High blood sugar can damage the kidneys over time. The kidneys help control fluid balance in the body. When they are under stress, fluid can begin to collect in the lower parts of the body because gravity pulls it downward. That is why the feet and ankles may swell. This swelling is called edema. One thing you can check is whether the swelling leaves a dent. Press your finger gently into the swollen area for a few seconds. If the skin stays indented for a short time after you let go, that is often called pitting. It does not prove diabetes by itself, but it does mean your body is holding fluid in a way that should be discussed with a doctor, especially if it is new or getting worse. Think of the kidneys like filters. They clean the blood and help decide how much fluid and salt the body keeps. If those filters are damaged, the system can back up. Fluid that should be managed properly may start pooling where gravity takes it, down in the ankles and feet. The daily habit here is to elevate your feet when resting. Try to raise them slightly above heart level for a while if you can do so comfortably. This helps fluid move back toward the center of the body. Also, reduce sodium. Many people think they do not eat much salt because they do not use the salt shaker, but canned foods, packaged meals, processed meats, soups, sauces, and snacks can carry a lot of sodium. Read labels. Your ankles may be telling you what your kidneys are struggling to handle. The seventh sign is sharp, stabbing, or electric-like foot pain, especially at night. This is often confused with arthritis, old injuries, plantar fasciitis, tendon trouble, or simply bad feet. Many people take pain pills for months without ever asking why the pain keeps returning. Nerve pain from high blood sugar can feel very different from normal muscle soreness. It may feel like a needle, a shock, a burning stab, or a sudden jolt through the toes or soles. It may appear when you are resting, not only when you are walking. It may wake you from sleep. And because it often comes and goes, people convince themselves it cannot be serious. But damaged nerves do not always go numb. Sometimes they become too active. They send strong pain signals even when there is no fresh injury. The pain is real. It is not in your imagination. But the source may be nerve dysfunction rather than a sprain or joint problem. Imagine a doorbell that keeps ringing even though no one is outside. The ringing is real, but the problem is in the wiring. That is how nerve pain can behave. And if the wiring is being damaged by high blood sugar, masking the pain without checking the cause can allow the damage to continue. A good habit is gentle foot movement before getting out of bed. Flex your feet, circle your ankles, and slowly pull your toes toward you. Do not force anything. The goal is to wake up the tissues and improve blood flow before you stand. At night, a gentle foot massage can help some people. Use light circular movements along the soles and around the ankles. The point is not deep pressure. The point is circulation, comfort, and awareness. The eighth sign is feet that stay cold even when the rest of your body is warm. Some people have always had cold feet, and sometimes that is simply how their body runs. But there is a difference between my feet get cold in winter and my feet are cold all the time, even in warm weather, even under blankets. Persistent cold feet can mean warm blood is not reaching the lower legs and toes as well as it should. High blood sugar can damage blood vessels and increase the risk of poor circulation. If the vessels become narrow or stiff, the feet may not receive enough warm blood. This can make them feel cold, heavy, tired, or weak. Think of your circulation like a heating system in a house. If the pipes to the farthest room are narrowed or blocked, that room stays cold no matter how warm the furnace is. The feet are like that farthest room. If the body cannot send enough warm blood there, the toes may stay cold even when you are covered up. Walking is one of the best responses if you are able. A purposeful walk helps push blood into the lower legs, strengthens the circulation system, and helps the muscles use sugar from the blood. If a long walk feels too difficult, begin with a shorter one. The number of minutes matters less than the decision to start and repeat it daily. Consistency is what changes the body. The ninth sign is hair loss on the feet, toes, or lower legs. This is one of the quietest signs, and many people never notice it until someone points it out. During a foot exam, I sometimes look at the tops of the feet and lower legs and see very little hair where there used to be more. The patient looks down and says, "I never paid attention to that." Hair follicles need blood flow and oxygen just like any other living tissue. If circulation becomes poor over time, those follicles may stop growing hair. The skin may look smooth, shiny, or bare. This does not mean every person with less leg hair has diabetes, but when hair loss appears together with cold feet, color changes, slow healing, pain, or numbness, it becomes part of a bigger picture. Think of hair follicles like small plants. If the water supply becomes weak, the plants may not die overnight. They simply stop growing. The lack of growth tells you something about the supply line. In the body, that supply line is blood flow. After this video, look at the tops of your feet and your lower legs. Compare both sides. Notice whether the hair is much thinner than before, whether the skin looks shiny, or whether one foot looks different from the other. If you see this along with other signs we have discussed, schedule a blood sugar test and talk to your doctor. A simple test can give you information that guessing never will. Now let me bring all of this together. Tingling, burning, slow healing cuts, skin color changes, cracked heels, swelling, sharp nerve pain, cold feet, hair loss on the lower legs or feet. These are not small things to ignore forever. They are messages, and the body often whispers before it screams. I have sat across from patients who were frightened, not because they did not care, but because they wished someone had explained these signs earlier. They wished they had known that the numbness was not just age. They wished they had checked the blister sooner. They wished they had not waited until pain, infection, or severe swelling forced them into urgent care. That is the part that stays with me. Many people do not need more fear. They need clearer information early enough to act. So tonight before bed, do one simple thing. Sit down and look at your feet. Take half a minute. Look at the heels, the toes, the skin color, the spaces between the toes, and the tops of the feet. Touch the soles. Notice whether both feet feel the same. Check for numbness, burning, cuts, swelling, or anything that has changed. This is not complicated. It is simple awareness. But simple awareness can protect your independence. And if you notice one or more of these signs, especially if they are new, getting worse, or happening together, call your doctor and ask about checking your blood sugar. Do not wait for a crisis. Diabetes is often manageable, especially when it is found early. Food choices, walking, weight control, medication when needed, and regular medical care can make a major difference. But you cannot manage what you do not know is happening. You worked hard for your life. You deserve to keep walking, driving, visiting family, playing with grandchildren, cooking, gardening, traveling, and living with as much independence as possible. Do not let hidden high blood sugar quietly steal those things while your feet are trying to warn you. If this video helped you, share it with someone you care about. A spouse, a brother, a sister, a friend from church, a neighbor who keeps saying their feet are numb or swollen. Sometimes one shared video can push someone to get the test they have been putting off. And if you want more clear health conversations for life after 50 and 60, subscribe to this channel. I am Dr. James Walker. Stay alert, stay steady, and take care of your feet because they may be telling you more than you think.